Hey John, how's it going, everybody? Welcome to
Well,
our webinar. Thank you everybody who has joined us. It's exactly 4 o'clock, so we started right on time. We have John Batchelor and Deborah presenting who are in New Zealand, and we have our folks from out west, Stephanie and Esther, and also, if off camera, I believe potentially is Tanya. And if she's not yet on the panelist, hopefully she'll be in there soon. And Erica. And obviously we have Cecilia who helped us organize this, did a very good job. I appreciate that. So I will give the word to John to take over, and John is definitely a wealth of knowledge and wisdom that could definitely share with the rest of our community. Welcome, John.
thanks, Eric, and welcome to everybody from around the world that have tuned in today. So it sort of put a wee bit of pressure on us. So a little special mention to our Irish friends and our Australian friends and the panelists as well. We've got a wealth of knowledge between all the panelists here: Deborah, Tanya, Stephanie, and a very, very good friend, Esther. All good digital masters. So one of the things that we wanted to do was get a group of people together so we can share all our knowledge. Not one person knows it all. So that's why we have a panelist, and we will have other panelists from time to time as well. But if I can start the webinar off, a big thank you to Craig. Craig is Esther's partner in crime, and he actually caught coronavirus and spent 3 weeks of hell. So this is a dedication to him, and he's come out through the other side, and just prior to this he was smiling. So welcome to everybody, and hopefully you enjoy this webinar today. It is an introduction, so we thought we'd just go back to the beginning. So if we do a series, we can help build up your knowledge. So the beginning, digital dentures, the beginning, 3Shape. I've looked at other software. What about you, Esther? Did you look at other software programs?
I did, and I really wanted to have something that I could control myself. And it kind of narrowed it down to both 3Shape and Exocad. And at the time that I made my decision to purchase, 3Shape definitely was the most user-friendly for dentures.
And what about you, Steph?
Well, Erica did a lot more research on this than I did, so you might want to ask Erica on that one.
Whereas since we were the same, Esther, 3Shape and Exocad were the only ones that were really around that stage. And it's interesting that Exocad's been bought out by Invisalign group, so it'll be interesting to see where they go. But since that time, there are other software programs around that have come through, but I still think 3Shape by far is the best software. They've got about 450 programmers, and the advancements every year. Esther is a beta tester, the same as we are, and so the advancements, as you see, Esther, are huge every year, aren't they?
Definitely, yeah, and even the 2020 that's being betaed right now is just it's so much more about dentures than it ever has been. It used to be all crown and bridge, and now all the updates are dentures related.
Yeah. And we're quite fortunate that Rune is very keen on dentures, and they're pouring a lot of resources into dentures. And I think the beta version that you and I are playing around, Esther, is going to be released in May, June.
I believe so, and it's just going to make things like waxing up so much easier. Yeah.
I know that's a bit of a teaser for everybody out there in the world that hasn't got the beta tested. It's a bit like a lolly shop with the copy denture and things like that is really, really good concept. So today is an introduction to digital dentures. It was a bit difficult for me initially when I got asked to do a webinar. Where do we start? Or what do we do? Do we just jump in for people that have had it for a wee while and you know, and show them some trips and some tricks and tips and things like that? Or do we actually just go back to the basics and have a whole series of small webinars so you can build up your knowledge base right back at the beginning? So that was the brief that was given to me by Dental Access. So this is an introduction to digital dentures. We will be running basic and advanced workshops, or we do run them now face to face, and I will be looking at see if we can do those digitally as well. And as I said earlier on, clinical workshops. Peter Anastasia, which I think you mentioned earlier on, Esther, as a friend, a mate, as we call them down under. We've sort of set up a Pro Academy, which is the clinical aspect where people come into our clinics, just 2 or 3 people at a time, and we go through the whole clinical procedure and then go out into the lab and go through that workflow. So hopefully we're twisting Esther's arm that we can set up a clinical aspect as well in Canada, and hopefully somebody in your neck of the woods, Eric, can pick it up as well and demonstrate the whole workflow. So I'll just go back to the other slide. I think I just hit the wrong button there. So clinical workshops. So we want to run a series of webinars, just 45 to 60 minutes on a specific topic. One of the things that I find with webinars, they can go on for an hour, 2 hours, and you get a wee bit of sensory overload. So what we've looked at, the panelists we've talked about, is just running a webinar on a specific topic for 45 to 60 minutes. And then that way we can help build up your knowledge base. And we've got a little group of guest panelists, wealth of knowledge. And so draw upon that wealth of knowledge by asking questions. And if I don't know it, Esther will know it. Is that right, Esther?
Yes.
Yep, and Stephanie and Deborah. As I said, Deborah is in the lab doing digital day in, day out. So she's got a wealth of knowledge. And we will have guest panelists as we get into other topics as well. And questions and answers. Please ask questions, and we'll, as a panelist, we'll answer those questions. If we don't answer all the questions, we'll maybe even have a webinar just answering questions. We want to simplify the process of design. Just present it in such a way that it's really, really simple. And here's, I don't know if you are online there, Rune or Raoul, virtual classroom. That's something I would really, really love to be able to set up a virtual classroom that we can have a little group of people, maybe 5, 10, or with some cases. We can actually go through those cases like we do when we run a workshop. So a virtual classroom would be really, really good. So some of the suggested topics, some of these came from Tanya and other people, was cross bites, class 2 and class 3 setups, design tips and tricks. There's between all the panelists, we'll share our tips and tricks. The occlusion, how do you get the occlusion if you're doing a upper denture against standing lowers or vice versa? And implants, can you do implant dentures? Yes, you can. And what about all the icons? Initially, it can be quite confusing when you see the screen. What was it like when you first saw your screen, Deborah?
Oh, you mean for the first time for designing?
Yeah, well, when you saw that, it's like when you've got a Word document or an Excel document, you see all these ribbons with icons, and did you find that a wee bit confusing?
Yeah, it doesn't take long to, once you're using it every day, naturally. And like with the 3 shape, you've got the technical documents in the back that if you ever get stuck, you just go straight to the manual and it's got a great step by step what they all do, what they all mean. It doesn't take long to learn.
And there's a thing in the back that runs in the background called a control panel, and we'll go into the control panel, and we'll probably do a basic one and then a more advanced control panel, how you set it up behind the scenes. And initially, having a company like Dental Access, who know Matthew, I don't know if you're watching Matthew, he's based in Sydney, he's a real wizard, and Jerome is in Melbourne, he's another wizard, and Erica or Cecilia and Eric are wizards as well. So hopefully when you get your system, a lot of those control panel is set up, because you really need to set that up correctly. So the other thing is importing facial pics from Trios. Stephanie, have you got a Trios?
Yes, I haven't done too much on the way of the Venice or the Smile Designers yet.
That's another one, and I think probably out of the panelists, Esther, you're probably the most experienced with the Trios.
Oh, I'm
Hi, Esther, you're muted. You have to put on mute. Oh, there you go.
There we go. Having the ability to import a picture or import a facial scan, a 3D facial scan, is an absolute game changer, especially when it comes to immediate dentures, because your communication then can be done by email or text message to the patient, and it takes all the anxiety of what their smile is going to look like for the final product. And so easy to use, so easy to use. Yeah.
Because I think, if I remember rightly, you when you bought your package, when you finally forgot, we'll talk about that later, but in another slide. But I think you had your Trios right from the get-go, didn't you?
Right from day one, yes. And we use the Trios pretty much almost 100% for partials and for immediate dentures. We're just doing some experimentation for full dentures, but not really quite there yet.
And we'll talk about that in another slide. So and immediates are fantastically done digitally, and we'll talk about that. So just going on digital dentures and concepts. How do you get started? Well, I don't know, all these people watching the webinar. If you've been analog for 10 years or more, you're probably a butterfly, what I describe as a butterfly in the analog world. You've got a wealth of knowledge and a wealth of experience, and it almost doesn't matter what problem that you experience, you can draw on that knowledge and solve that problem. Whereas when you go digital, a butterfly often forgets that once they were a caterpillar. And when you decide to go digital, or if you decide to go digital, when you decide to go digital, just remember, you are going to be a caterpillar. You want to be a butterfly, but just take it slowly, learn the basics, and learn the basics well, because there is a progression. To become a butterfly, you go through the cocoon stage, and then you will become a butterfly again. So let's get the basics. What equipment do you need? You need some software, and you need a scanner. You need a printer, you need a mill. You don't need all those things straight off. All you basically need is some software and a scanner. One of our panelists went out and bought a printer first. Is that right, Esther?
Yes, I admit it. And I had nothing to print because I didn't even have software to design anything, but I was pretty proud to own a printer. Yeah.
So there was a wee learning from one of our panelists that went out and bought a printer and didn't have the software and the scanner to drive the printer. But that's enthusiastic, and I might have been a wee bit to blame there when you came down under and saw how we did digital and went back and you bought your printer. So software and scanner, that's all you really need to buy initially. but printers have come down in cost, and there will be a webinar about printers, what you can and can't do. So I would probably suggest that you may buy software, scanner, and a printer initially. And then possibly a mill. There's outsourcing services now, but mill, when you get into mills, that's a whole new mind learning and software. Where I said before, you need support. If you get into milling, you need support, lots of support. So 3Shape software. I think the panelists will all agree. We highly recommend 3Shape as a software. Scanner. 3Shape have got a whole range of scanners. The E2, the E1, the E2, the E3, the D2000, and the new baby on the block, the E4. In the laboratory, we have the E2, E3, and the D2000. We bought the D2000 first, and I'll explain why we have got the other ones. What have you got, Esther?
Oh,
We have
you
the
are okay.
E3.
You're good.
Hi, we have the E3, but if I was to purchase today, I'd buy the E4.
Yeah, I heard that you were thinking or looking at trading the E3 in and for an E4.
Always looking, yes.
Always looking.
Yes.
Toys to buy. And what about you, Steph? Steph, what have you got?
I think Steph is muted right now still, but Tanya just joined us, John. Oh,
Oh,
John, we
hi,
have the
Tanya. How are you?
E3.
So, that's good for you to join us. And so Tanya's has also got a wealth of knowledge on digital, and I think you've been playing around with Bella 3D as well. But in our laboratory, as I said, we bought the D2000. The D2000, why we bought that was we were orthodontically based, and we wanted to be able to scan two models at once. I do like the facility. Is that right, Deborah, for using digital dentures, because you can use you can scan 2 impressions at once when you come to do a bite. Sorry, Deborah.
Yeah, you do save time, especially with, even if you're doing copy dentures, you can do both arches at the same time. You can do your upper and lower at the same time instead of putting the upper and scanning it, doing the other side. So, but do they still make the D2000, Eric?
yes, they do actually. It's still on the. You can still purchase a D2000. Technically speaking, if you compare the D2000 and the E4, D2000 is very close to the E4 in terms of specs.
The E4 is just about a micron more accurate, and it's a wee bit faster. But as Deborah described, because you can put, when you're doing a copy denture, you can put the upper and the lower in together, so you save a lot of time. One of the reasons why we've got an E2 and E3 as well is we do actually have out clinics, multiple clinics. So I'm sort of experimenting around those out clinics to be able to scan impressions and scan retries and things like that, and about the accuracy. And without clinics, I want a definitive answer whether an E2 is accurate enough, or do you need to go to the E3, or is it better to give a clinician a trios scan? So as we talked with the other panelists, Tanya, I think you've got a trios, haven't you?
Yes, we do. Yeah, we ended up getting it through Dental Access last September, and I love it.
Okay, so there's 2 panelists that love their trios. So at some stage we'll have a really good discussion about which scanners and what they can and cannot do. And printers, this is a whole webinar in itself. And the first printer I bought was the object printer, the Stratus printer. That's about $70,000. Great workhorse. It's a Hummer, but it's expensive to run.
Still going.
Still going. We've got the form printer. It's a great little printer, and we'll talk about the pros and cons of printer. The Asiga is a fantastic printer, and I would recommend, if you're going to buy a printer, it's a wee bit more expensive than the form printer, but it's a very, very good. It's a fast printer, and the new baby on the block from Asiga, the 4K80. That, I was talking to Graham in Sydney, and that is ready for shipping now. It's a very, very fast printer, and it's got a big print bed. NextDent printer, I haven't had a lot of experience with the NextDent printer, but I think you might have had, Steve.
Yep. Myself, Erica, we have the printer, the NextDent, and I actually love it. It's got a nice build platform. We get very good results. We mostly do our printed try-ins on it, but we really love our NextDent printer. I think it's great. And I know a lot of things, but people say that I mean, the Asiga is open, but the NextDent isn't. But we found that the NextDent resins are very good resins, and pretty comparable in price, really. So I haven't had any trouble with. We haven't had any trouble with our printer, and I like it. So.
Yeah, well, what about Tanya? What printer have you got, or printers?
We have the Asiga. You know, I kind of did the same thing a couple years ago. Was in Chicago, fell in love with the whole 3-shape design. Actually, Stephanie and I remember being in this room, and Stephanie and I had the chance to do some design work on there. So our digital adventure started a couple years ago in Chicago. So from there, we ended up getting the E3, and then fast forwarding. During that trip, we ended up getting a little entry-level printer, which we had some successes but more failures. Became very frustrated, and so we ended up buying the Asiga, and it's been nothing but perfect. So you gotta take the plunge and spend the money and get one that's going to work for you.
And Esther, you've had an experience with printers because you bought your first printer without all the software and the scanner. And what's your little journey of printing?
Very, very similar to what Tanya's is. Actually, the Asiga is our 4th 3D printer. So we started with this entry-level open printer, a lot of failures. Then I went to a Forum Labs just so I could kind of really understand how 3D printing worked. I played around a little bit with the filament style type printer. Just time frames were not there. And then we ended up buying the Asiga. And there's like you had mentioned, it's a whole webinar as to how you'd want to choose a printer.
Yeah, so and I think this is one of the advantages of having a webinar with panelists, because there's a wealth of knowledge about certain subjects, and printing is speed versus accuracy and things like that. So we will do a whole webinar about printers and what to look for and some of the pitfalls. And mills. I've milled on the Cera mill. I've milled on the Roland. Roland's a really, really good mill, but if you're doing a lot of volume work, I don't think it's up to speed for that. My good friend or my mate in Brisbane and I had a Roland mill, and we literally destroyed those mills. It's not. I'm not saying it's not a good mill. It's an excellent mill, and you've got to look at what you're doing. If you're a Crown and Bridge lab doing a bit of pros work and milling the odd splint, very, very good. But I think if you're a high volume laboratory, you want a more solid mill like the PM7 and the IMES I-Core. Those are probably the only 2 mills that I would recommend if you're getting into you want to get into volume. That's the Ivoclar PM7 and the IMES I-Core. There are other mills out there. I think Zircon-Zahn is another great mill, but I haven't had any experience with that, so I can't comment. And I think that's again with the panelists. The strength of the panel, having a group of people, is that it's we'll have difference of opinions from time to time, and we'll have discussions, and that's a strength. Have you had any experience with other mills, Esther?
No, at this point, only just the PM7, other than like seeing some friends of mine and what they're using for mills. But one of the kind of the not talked about things with a mill is that there's CAD and there's CAM software. And we talk a lot about the CAD software with 3Shape, but we don't talk a lot about the CAM software. And a mill is just a mill, but you have to kind of look at how are you going to get that object you've designed into the mill. And does that mill that you have, it may be a really good quality mill, but it may have very complicated camming software with it. The PM7 software, the CAM software, is very easy to use, and that's what we use in our clinic.
Yeah, I think the IMES iCore software is getting easier to use, as you said, with the PM7. And I think when we'll have a webinar, and Jerome is very he used to run a milling centre with IMES iCores, and also another a good friend of ours, George Calburn. He is very knowledgeable on mills. So I think if we have a webinar on milling, we'll get those two people as panelists as well, and we can have a good robust discussion about mills. What about you, Tanya and Steph? Have you had experience with other mills at all?
So for my office, we currently don't have a mill. That's not in my business plan at this point, but we are outsourcing our cases to Esther's office for milling. And for us specifically, what we're doing in our office, we're actually getting the teeth milled, and then we're investing that, and then eyeball basing the palate. So that's what we're doing right now for my business.
What about you, Steph?
Well, we've just bought the PM7. It hasn't been installed yet, so and we haven't had the training because it came like 2 days before the corona shut down. So, but I know that Erica and me, we were always looking into a lot of the different mills, but I think for what we want it for and what we need it for specifically dentures, we both decided that the PM7 would be the way that we wanted to go. So, and we're both. But we really like Ivoclar and all their Ivoclar products, so it kind of made sense to go that way.
Whereas, as I said, the two mills are really the ones to consider as the PM7 from Ivoclar and the IMES iCore, because the IMES now has come out with what we didn't talk about as an ionizer. And if you're going to look at a mill, the first thing, it's got to have an ionizer, or really needs to have an ionizer, in my opinion, if you're going to mill prosthetics, because as soon as you mill acrylic, it generates electrostatically charged particles, and you want to have an ionizer that takes those the charge away from the particles and makes it easy to clean. And I like what you touched on there too, Tanya, that you don't necessarily need a mill initially. You can outsource. So one of the things with digital is when you're learning, you want to be able to go digital, analog at any point in time while you're learning your journey. And the middle is your final frontier. And I'm looking forward to the discussion we have about printers and printing a final denture or milling. So if you want to mill a final restoration, as you touched on, Tanya, you can mill your arch and go back to your laboratory, and you could print a base, put it together, and flask it, and then mill, as I said, mill your arch, put it into your flask and inject, and we can talk about that. So that's a little halfway house, and there are people that have mills that, and I know George from Perfect does outsourcing as well, and I think Argon's another one. So you don't need to go out and buy all this gear straight away. So as I said, you can buy software, you can buy your scanner. That's all you need. But I suggest that you probably will buy a printer, and then you can, if you want to at this stage get a final restoration, you can mill. But printing's catching up, and we'll look forward to that discussion, and I think that'll be a nice, robust discussion to have on there. So yes. That's the equipment that you need. So what can you do digitally? So as I said, but way back in 2000 and 2011 when I started looking at it, and it was only about 2012 and 13 that all you could do is full upper and lower dentures. And there'll be a webinar how to do that. Full upper or lower dentures, opposing. It's only in the last couple of years you're being able to really do an upper or lower denture to opposing teeth. Immediate dentures. This is an immediate denture done from a trios scan. The good thing about immediate dentures, although you don't want to tell all your dentists, that you can actually, if you receive an intraoral scan in the morning, you can design that denture and have it milled and back into the clinic ready for insertion the next day. Would you agree with that, Esther?
Yeah, 100%.
Yes, I know you do a lot of your immediates. So there's a lot of advantages of doing immediates digitally. I don't put the pressure on like that, do I, Deborah?
No, I do have a few dentists that do a lot of immediate partials. They'll take a scan in the morning, and then I've milled an immediate partial straight from the intraoral scan, and it's in there before 5 o'clock. But yeah,
so
too.
Yeah, and that immediate there is done in a monoblock, whereas there are now pucks with multi layered pucks and partials. As Deborah said, we can, and the webinar about chromes, how you can do chromes. So you can print your chrome and then cast it, invest it and cast it and finish it as we know in the analog world, or you can laser sinter your chromes. You can do an intraoral scan design and then get them sintered. I think there's a sintering lab up in Canada, is that right?
Yes,
Esther, go ahead.
We do have a few labs now that are offering one main one in Canada, 3D RPD, that will do sintering, and they'll just accept your straight from your intraoral scan. They'll accept the files. Very, very easy and faster turnaround times because you're not waiting for a model to have to be shipped to the lab.
We've had a good amount of success with having titanium frames being milled, just sending our trio scan to have the titanium frames come back, and they're just so lovely and dainty and lightweight. As Steph pointed out to me one day, I was messaging with her because it's always hard to find a lab that can produce dainty clasp assemblies and finer major connectors. Steph's point was that when you're having titanium frames milled, that if you're having a repair done, then a cast clasp is not going to necessarily bond with that titanium frame. So those are some of the things that we've been learning as the months have been rolling on, but we love the milled titanium frames. They're beautiful.
Are they milled in Canada?
Yes, in Alberta.
Alberta, and I think George from Perfect mills titanium as well. And you can, if you get a mill, you can mill, but the pucks are quite expensive. But I think economically, if you've got a small frame, you could probably mill in house. But outsourcing to a milling centre is a very, very good idea, or a sintering service is a good idea. And as you said, Esther, cash flow. Cash flow's getting cash in is king. Whereas if you can turn around your chrome frames faster, whereas some of the, I don't know what it's like in Canada or Australia or Ireland, that in New Zealand sometimes in busy times it can take a month to get your chrome frames back, and it's just laser sintering and is fantastic. And I think there's a webinar in itself about chrome partials, designing and how to manufacture them. So flexible resin, is there much flexible Valplast and thermosenes done in Canada?
There is a fair amount with Valplast, yeah.
So you can design those digitally. You can mill the teeth, and as we described it earlier with with dentures, so you can mill the teeth, design it, print it, put it together, flask it, and inject it. So so flexible resins. This here is one of Deborah's little experimentations. Was that right, Deborah? Was that a year or 2 years ago you did that?
Probably a couple of years ago, yeah.
You want to just describe that partial?
Well, it's just the partial with the RPD program and just milling the teeth and the base straight away. So yeah, it's pretty simple, but no
So
class. That's the only thing
so you milled the base. You didn't. It's not injected or anything like that.
No, everything's milled, and then it's just socketed for all the teeth. The teeth are all milled, and you just bond it together, and then it's into the heat cure pot, and it's a quick polish. They work out quite good.
So that's something we can talk about in the partials. And the other thing is metal free. I don't know what it's like in Canada and other parts of the world, but some people just would like to go metal free and peak with milled peak partials. Is there much peak being done in North America?
I can't speak to that. I've seen this at the conventions, and I've kind of wondered. We haven't done any of those cases in our office.
I can only speak to that in terms of some clients who have shared that knowledge about the peak. I understand that some people have, but I'm actually very curious to know how Esther and everybody else here have they've tried it out.
It's on my to-do list of things to attempt. And just like Tanya, I'm seeing it at conventions. I'm seeing some chatter in some of the Facebook groups, but myself, no, I have not experimented with it. We've experimented a little bit with acetyl resin, especially with temporary, and very, very millable, very fast, and have had good success with that. But we have not tried peak or Solvay or anything to that effect as of yet.
Yeah, we've used peak, and it is very, very good. And I've used peak in little unilateral situations as well. So there's going to be an interesting discussion, as you can see, with partials. It's quite a we may need to do that over 2 webinars, or make a slightly longer one, but it is interesting. So immediate dentures.
Just want to interrupt. We use the peak as well for the meshes and the implant dentures as well for a lot of our surgeons, don't we? Just because it's lighter and it's pink as well.
Thanks for that, Deborah. Whereas peak is used in the crown and bridge area for you can actually build ceramics up on peak, and it is very, very. Although it seems flexible, in the partials you've got to make it a wee bit thicker than what you normally would with a chrome, but a lot thinner than you would with a plastic, to try and get a wee bit of rigidity. But as Deborah said, for implant cases, for a secondary casting for strength, it's really, 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 really good. So so copy dentures. This is one that's really, really coming to. I think it's about May or June, and so there's a copy denture. And this case here, as you can see, a lot of cases where they've lost posterior support, dentures that are a number of years old, they can go from a class 1 to a class 3. So with using the copy denture technique, you can re-establish them into a class 1. And you know, it's quite exciting, Esther. You're finding that?
Oh yeah, very, very, very much. It opens up a whole world of opportunity. Yeah.
Absolutely. What about you, Steph and Tanya? Have you used the copy technique at all?
We tried it a few times. Erica knows more than me.
And
George, yeah, just to kind of, because a copy denture really allows us the opportunity to fully digitize a denture clinic, because it would kind of replace having to do a rebase or a reline if someone's not too sure what a copy denture is.
Yes, I don't like the word copy denture because it's not really, as you saw in that last slide, she she had lost posterior support over the years and gone to into a class 3 scenario. Whereas, I'm not copying that. Whereas what I am using that as a basis and actually improving on that. So, and you can sort of incorporate that into your full the way you do full falls, which we'll explain in a few minutes. So the copy denture, it's you're not 100% there, but it's pretty well, you know, it's a good 80 to 90%, wouldn't you say, Deborah?
And with the new update as well that's coming out in May, they've really done some work on the copy denture. It's a lot more easier, isn't it, with segmenting the teeth, isn't it, Esther? And and now we're going to probably be able to TM5 it as well. If we can oversize mill it, it's 100% there.
Yeah.
I would say about the copy denture, the ones we have done, it was a very good. There was one particular patient that we used the teeth for, and the teeth were fine, but she liked the shape and the size of her old denture. She loved her old denture. So Erica scanned in, did a little wash, scanned it in, and gave her, we basically sent it off to Perfect, actually, at that one particular one. And it worked very well for that one.
That's a very good point, Steph, that, you know, we all have those really, really fussy patients that love the aesthetics that they've got, but the fit is just not fitting the way it likes, and they want a new denture. That, you know, they don't want just a reline, whereas a copy denture is a very, very, very good technique. And as Deborah said, there's another little teaser that's coming, so look out for the new update. And splints as well. You can do splints digitally. You can end up printing those splints or milling them. So there's a webinar in itself, how to do that. So that's at this stage the full gamut of what we can do digitally. So remember 2011 when I first looked at it, really it was 2013. So that's, you know, 7 years. We can now do most things that we really want to do digitally. Has the panelists got anything to add on that slide there? No. So let's move on. What are some of the advantages? Because we're just coming up to time. Reproducible. It's
I was about to say something. I was like, John, I don't want to rush you, but this is a very good. I mean, it's very intriguing. It's like I don't know if everybody feels that way, but feel free to send some comments. That'll be great.
This is the introduction to digital dentures. So it's, you know, it is a big topic, and I want to really get the message out there. You know, you can do practically everything you want to do digitally, and it's better. So it's reproducible, it's strong, and it's lighter. What does that mean? It's because mechanically we're milling the arch as one complete arch. You know, if you go back and thinking of all the repairs that you do, a lot of them dentures, when they get old and don't fit, they fracture. They fracture through an interproximal, and that's a weak point. Whereas when you do digital dentures and mill an whole arch, that becomes mechanically strong. Whereas some systems do, you go back and use tooth cards, and to me that's still a weak point. So it is stronger and they're lighter. Have you had any panelists had any patients that have come in and say, all these dentures they feel a lot lighter?
Mm-hmm. Yes.
Yeah. So that's one thing you will find. And the patient is able to take the try-ins home and test them out and have a look at the aesthetics, and we'll talk about that. It's more of a clean and tidy workplace. It's environmentally friendly. We used to take out about 7 or 8 big wheelie bins of rubbish every week that went to the tip, whereas that's cut down to about 2 bins now. Yes, there is a wee bit of leftover from your pucks, but you can keep the pucks and mill as much out of that puck as you possibly can. So there isn't a lot of wastage. Study models, My wife's an orthodontist, and we do a lot of orthodontics. And we used to make all orthodontic models out of plaster and stone, which is not that great for the environment, and they get chipped over the years. Whereas a printed digital model, a printed model, lasts. And if you're doing a suck down, you can do time and time again as many suck downs as you like on that printed model. So a lot more environmentally friendly. Time savings, not initially. Remember, to become a butterfly, you've got to become a caterpillar. You'll go back to being a caterpillar. But once you get proficient, there is quite a few time and savings. It's an accurate and a systematic workflow. There's 1 to 2 lesser clinical appointments, reduced human error, and this is the big one with COVID-19, earthquakes, whatever. Being able to work from a remote location is really, really important. We've talked about going back to work in our little bubbles, and Deborah will be working from home until we come out of total lockdown.
So John, just one thing I'd like to add to that personally, and I'm sure this is going to apply to a lot of people watching or even some of the panelists, is for me, getting into the digital world, a big part of that was my risks. You know, from doing so much work over the years, 15 years of mixing plaster and stone and pressure material and setting up teeth and grinding the teeth and this and that. It's enabled me to work in a different technical manner and free up the pain in my arms, like in my wrists and my fingers, right?
Absolutely. And again, with people that have got allergic reactions over with methacrylate, and along came injectable acrylics like the Ivoclar, and it was all capsulated. Whereas now the milled pucks, very, very dense acrylic, really, really dense. So exactly what you're saying, there's so many health benefits as well. And diagnostics, this is the one that I love. Here's a patient that came in, broken denture, couldn't really probably do a copy denture with that because there's a lot of the upper missing. And she was so embarrassed. Her daughter was getting married, and we had 2 weeks to make a denture for her, and that's the upper. And we were able to do that digitally in 3 or 4 days, and so that's the final result. So diagnostics, and I know I've opened her vertical dimension up from where she was. The bite may change a wee bit. I can keep doing some occlusal adjustments until I get the final RCP, and then I can just mill a new lower or new upper. So diagnostic work, really, really great. So the 4 steps of doing digital denture this is the one slide that I'd like you all to take away. If you remember, you've got to create, you scan, design, and manufacture. And this is a webinar in itself, but how to do it clinically. You've got to take some impressions, and you notice that vertical dimension and bite are the 2 big ones. And I think, Tanya, you might be using an orange stick with a bit of alginate on it. Is that right? Or
no, that's actually Carson.
Oh, Carson.
That's my associate person. Yeah.
Yeah.
So centric
Very
tray.
good
If you can take a preliminary vertical dimension and bite, and that's what I think Esther talked about earlier on, CAD, computer aided design. So you need to create what's called an order form. So think of that as your prescription form. Then you scan it into your scanner. Then you design it. So you can design bite blocks, or you can design a denture. And notice how Deborah is sliced off the lower posterior teeth. Then we can put some wax in there. That's sort of done through a copy technique, so we'll talk about that. The good thing about that technique is you can have a look at your 6 anteriors, the aesthetic zone. You can also slice the upper teeth off as well, like the lower, and put some wax rims on those. And then you get into the laboratory. This is the CAM side, the computer aided manufacturing. So then you construct those bite blocks, and if you want to, you can get into Gothic Arts tracings, or the CAD one, you can put some wax 2 sheets of wax on each of those, and it'll give you some room so you can take a conventional bite like we know. Then I tend to use a closed mouth technique. So take some secondary impressions, again, create your order form. Every time you do something new, you create a new order form, you scan that, and then you design your denture, and then you construct that. So we tend to print those. You can mill them, but printing's a lot more cost effective. And then you go, this is the very, very first digital denture that we ever did a number of years ago. And then all going well, if you vertical dimension your bite and everything looks good, you can then create and a new order form and construct it. So I'm looking forward to the discussion about milling your final process or printer, and that's the final denture. So you notice your clinical steps can get less. There's impressions, your secondaries, your try and your bite. And we're just about near the end, and I'm just going to turn the volume up there. Esther is a fellow CMCD instructor. So can you get suction with a milled denture?
100%.
Yeah.
So hopefully, thank you for that. So Esther, so hopefully, and that patient has got a very, very atrophic ridge. I don't know what it's like in Canada, but most of our patients are got atrophic ridges, lower ridges. Here's a
Brilliant. Yep, pulling my beard.
So yes, you can get suction and using that Dr. Abe's technique. So we've gone a wee bit over our 45 minutes, I think.
Yeah.
So I think I'd like to thank everybody that's tuned into the webinar today, and hopefully you got something out of the basics. For those people that are thinking of going digital, we encourage you to do so. I'd like to thank the panel for your thoughts, and I'd like to thank Dental Access for the opportunity. So that's Belinda and Pierre. They are the directors of Dental Access. By the way, I'm not an employee of Dental Access. I don't get paid for Dental Access. And all the panelists, and today we're doing this for the love of sharing the digital knowledge. And Deborah, a huge thank you. You put in so many hours to make digital work. So if you've got questions of how to make it work in the laboratory, Deborah's a person. And special thank you to the person on the right, Peter Anastasia, a mate down under. You know Pete, Esther, and next person to Peter is Terry McHugh from Melbourne. The IMES iPod, that was the first digital denture a number of years ago that we milled in Australia. That's myself. And so the last person to the left there is Matthew. He's an absolute wizard when it comes to CAM technology and writing programs and things like that. So a big thank you. So go digital, and this is what Deborah looks like today. Is that right, Deborah? So, enjoy your journey, and please fire some questions along, and anything you'd like to know about digital, and we'll make a little webinar